Carotid arteries are the two major arteries that supply bulk of the blood to the brain. They are the major arteries to the brain. So, hardening of the artery or atherosclerosis is now a common disease. Just like atherosclerosis affects the heart, it can also affect the arteries to the brain. When it affects the arteries to the brain, obviously there is a plaque buildup, and so what happens, the artery gets narrowed. If the artery gets narrowed to significant degree, generally more than 75% of its luminal area, then there is a good risk for, there is a good chance that the patient will get a stroke in the next 24 to 36 months. This is another area where detection is extremely important, because unfortunately once a stroke happens, the game is over. We cannot do too much to help the patient. This is one area where we need to get to the patient before he suffers from a stroke. So this is again, if we can detect it by ultrasound, it is called duplex scanning, which is very simple. It takes about 15-20 minutes to do the scan, a complete scan. It is non-invasive, can be repeated over a period of time, and once detected, if it is indeed a tight stenosis, which means more than 75% blockage in the artery, we can actually remove the plaque. The operation is now so sophisticated that it can be done under local anesthesia, or what we call as a regional anesthesia, and the patients go home in 24 hours. And it is a very successful operation. In fact, it is the most common vascular operation done in the United States now. The procedure is essentially making an incision in the neck. The patient is awake, he will be talking during the operation, and we expose the artery, then isolate the artery, then cut off the circulation to the brain during the procedure, open the artery and literally remove the plaque like cleaning a pipe, if you will. This is called endarterectomy, because we are removing the inner layers of the artery, and then we close the artery back, and then usually the patient is observed overnight in the hospital and they go home the next day. However, now as we speak, there is now a new treatment called stenting. Just like we can stent the arteries in the heart, we are now considering stenting. It has been already done. We are one of the centers. There are 70 centers in the country that are testing whether this stenting is better than the operation, because the operation has been highly successful and the risk of operation is about 1 to 3%. So if we can do the stenting, and if it is as good as the operation or superior, then obviously we would prefer stenting. So that is the next, I would say within the next 2 to 3 years, the results will be available to see if the stenting is better. But certainly is a very attractive option, so that you don't need to have an incision in the neck. And we already have done about more than 200 of these cases with very good results. So. Again, anyone who has a risk factor for atherosclerosis or hardening, if someone who already has had coronary artery disease, patients with hypertension, patients with history of smoking, and patients who have diabetes, they are all risk factor for stroke also. So any one of these people with risk factors, of course, should be tested. Otherwise, anyone above the age of 65 should have at least perhaps one screening test done maybe once a year and have it done, so that way we know the arteries are clean, we are all happy. If there is a block, let's assume it is only 50% block, again nothing need to be done, but that kind of patient will need a follow-up ultrasound or duplex scan every 6 months, so that we watch carefully. And if his cholesterol is high, we control the cholesterol. If he is smoking, we ask him to stop smoking. Good control of diabetes. So all these risk factor modifications are important. And then we follow, and if for some reason his plaque buildup keeps on growing and goes to 75% or greater, then we can at least pick it up and treat him.